A case of vaccine-derived polio has been confirmed in a 2-year-old child from Tikrekila in Meghalaya. A senior official from the Union Health Ministry official emphasized on Tuesday, August 20, 2024 that this is not a case of wild polio, but an infection that presents in some people with low immunity. The World Health Organization declared India polio-free in 2014 after the last case of wild polio virus in the country was reported in 2011. Health Minister Ampareen Lingdo on Wednesday said the World Health Organization (WHO) is investigating to confirm if the new strain of polio identified in the state is wild polio. The first suspected case of the new strain was reported from a village in the Tikrekila area of the West Garo Hills district on August 14. A 2.5-year-old child taken to the Goalpara Civil Hospital for treatment was suspected to have been infected by the poliovirus strain.
Mistaken Rajasthan or something, I'm not sure. Now, we need to allow the WHO to further investigate. It's called wild polio. It's a different strain of polio to my understanding. However, Government of Meghalaya has focused its attention, Health Department, we are focusing our attention on this child who was likely diagnosed by a likely strain of polio. So we are in touch with the family of the child and under observation, and I have been briefed that child is okay. So now we need to figure out what is this wild polio. We need to figure out whether the WHO will give us further advisories or whether or not there will be a requirement for the institutioning of a new vaccine which will also cover these new strains, I'm told. Not a medical doctor, but to my understanding, I think that is what this entire story is all about. After so many decades, they find a new strain of polio. I think it was called the wild polio.
Ma'am, vaccine hesitancy is there. We came to know that vaccine hesitancy is there in parts of the
You see, hesitancy. What is hesitancy? When families refuse to allow their children to undergo a certain vaccine. This is an option left to the public. Therefore, awareness of certain child illnesses which can be detrimental to the growth of a child is very necessary. Several factors are there. Hesitancy is not a new phenomenon. Hesitancy has been there from before. But more or less, with this intricate approach that we now have at our disposal, the ashas going door to door, the doctors, the health providers, the MLHPs, we have a huge battalion now working on various grounds. And hence, this hesitancy now is reducing substantially. However, this is what happens when hesitancy leads to an irrevocable condition of a child.